We live in a world teeming with viruses, microscopic entities that vastly outnumber us. These unseen forces are constantly evolving, adapting, and sometimes jumping from animals to humans. Some pose significant threats to human health, reminding us of our vulnerability. One such virus is the Chandipura virus, first identified in 1965 in India. CHPV belongs to the Rhabdoviridae family, which includes the rabies virus. Initially isolated from patients with encephalitis-like illness, CHPV is a serious public health concern. Understanding these viruses and their transmission is crucial for prevention and control. The Chandipura virus, first isolated in 1965, remained relatively obscure for decades. Recently, it has garnered attention due to outbreaks of a severe encephalitis-like illness, primarily in children. This trend has raised concerns about its potential to cause widespread epidemics. Belonging to the Rhabdoviridae family, CHPV shares its genetic makeup with rabies. CHPV's single-stranded RNA genome allows it to rapidly mutate and adapt. The virus affects the central nervous system, leading to brain inflammation or encephalitis. The high mortality rate among young children makes it a worrisome public health threat. Chandipura virus spreads through the bite of infected sandflies, tiny insects belonging to the genus Phlebotomus. These sandflies thrive in warm, humid climates and are often found near human settlements. They breed in moist soil and decaying organic matter. The transmission cycle begins when an infected sandfly bites a host, typically a small mammal. When a sandfly feeds on an infected animal, it picks up the virus. The virus replicates inside the sandfly, reaching its salivary glands. When the infected sandfly bites a human, it injects the virus into the bloodstream. The virus travels to the central nervous system, causing severe damage. The symptoms of Chandipura virus infection typically appear within 3 to 14 days after the bite of an infected sandfly. The initial presentation often resembles a flu-like illness, making it difficult to distinguish from other common infections. Patients may experience fever, headache, muscle aches, fatigue, and loss of appetite. As the virus progresses, neurological symptoms begin to manifest. These can include confusion, disorientation, seizures, paralysis, and coma. The rapid onset and severity of neurological symptoms are characteristic of CHPV infection and require immediate medical attention. Early diagnosis of CHPV infection is crucial for improving patient outcomes. However, the non-specific nature of initial symptoms and the lack of readily available diagnostic tests pose significant challenges. Laboratory confirmation of CHPV infection involves detecting the virus or its antibodies in blood or cerebrospinal fluid samples. Section 5. Vulnerable populations, children at highest risk. While Chandipura virus can infect people of all ages, children, particularly those under the age of 15, are most susceptible to severe disease. This increased vulnerability is likely due to their developing immune systems, which may not be as efficient at fighting off the virus. Additionally, children's smaller body size means that even a small amount of virus can have a more significant impact. People living in areas where sandflies are prevalent are also at increased risk of CHPV infection. This includes those residing in rural communities, near forests, or in areas with poor sanitation and hygiene. Factors such as overcrowding, lack of proper housing, and limited access to healthcare further exacerbate the risk. Pregnant women infected with CHPV may also be at risk of complications, including miscarriage, stillbirth, or congenital disabilities in their babies. However, more research is needed to fully understand the impact of CHPV infection during pregnancy. Section 6. Outbreaks. A stark reminder of Chandipura's potential. Since its discovery, Chandipura virus has caused several outbreaks, primarily in India. The first major outbreak occurred in 1993 in Andhra Pradesh, claiming the lives of over 40 children. Subsequent outbreaks have been reported in other Indian states, including Gujarat, Maharashtra, and Karnataka. These outbreaks typically occur during the monsoon season, from June to September, when sandfly populations are at their peak. The outbreaks often coincide with periods of heavy rainfall, which create favorable breeding grounds for sandflies. The close proximity of human settlements to sandfly habitats further facilitates the spread of the virus. The sporadic nature of CHPV outbreaks and the lack of widespread surveillance make it difficult to estimate the true burden of the disease. However, the high mortality rate associated with CHPV infection, particularly among children, highlights the urgent need for effective prevention and control measures. Section 7. Prevention and treatment, our best defense. Currently, there are no specific antiviral drugs available for the treatment of Chandipura virus infection. Treatment is primarily supportive, focusing on managing symptoms and preventing complications. Patients may require hospitalization, intravenous fluids, and respiratory support. Prevention remains the most effective strategy for combating CHPV. This includes reducing exposure to sandflies through personal protection measures, such as wearing long-sleeved clothing, using insect repellents, and sleeping under insecticide-treated bed nets. Controlling sandfly populations is crucial for interrupting the transmission cycle of CHPV. This can be achieved through environmental management strategies such as eliminating breeding sites, spraying insecticides, and improving sanitation and hygiene in affected areas. Section 8. Staying vigilant, the future of Chandipura. Chandipura virus serves as a stark reminder of the ever-present threat posed by emerging infectious diseases. As we continue to encroach upon wildlife habitats and experience the impacts of climate change, the risk of encountering novel viruses like CHPV will only increase. Strengthening surveillance systems, developing rapid and accurate diagnostic tests, and investing in research for vaccines and antiviral treatments are crucial for staying ahead of the curve. Public awareness campaigns educating communities about CHPV, its transmission, and prevention measures are also essential for mitigating the impact of future outbreaks. The fight against Chandipura virus requires a multifaceted approach involving collaboration between scientists, healthcare professionals, policymakers, and communities. By working together, we can enhance our preparedness, develop effective interventions, and protect ourselves from the threat of this deadly emerging virus.